Thank you, Kevin. As we age, our health needs do evolve from physical health to mental well-being. Dr. Robert Zorowitz is an expert in geriatric medicine. He's also the Regional Vice President of Health Services for Humana. He's joining us live this morning with more details. Good morning to you, sir.
Good morning. Good to be here.
Yes, thank you for joining us. First off, can you start by explaining why primary care is so important for older adults?
Yeah, absolutely. It's near and dear to my heart. As we age and as people get older, we become more complicated. We develop significant changes in not only medical health, but physical functioning, mental health. We collect medications by the dozens, and it's really important to have a primary care physician who can assemble this whole jigsaw puzzle, put it all together, and develop the trust and relationship to really provide the care that's necessary to maintain not only longer life, but better quality of life.
Yes, of course. So with that said, what are some of those specific benefits seniors can expect from regular primary care visits?
Sure, with regular primary care visits, you not only get checkups, but you also get check-ins. How are you doing? How's your physical health? Are you able to move? How's your walking? How are you feeling mentally? And also, this is an opportunity to review preventive services and vaccinations and all the things that are important, not only to manage what disorders and diseases you may have, but also to prevent future disorders and diseases.
Well, doctor, what are some of those key screenings that you recommend, particularly for those who are 65 and over?
Sure, I would be remiss if I did not mention diet and exercise. That never goes away. It's still really important for aging. You want to be able to keep moving, but also talking about preventive screenings such as vaccinations, screening for common disorders such as high blood pressure, diabetes, cardiovascular disease, and the variety of cancers. And the good news is that all this is usually covered by Medicare or Medicare Advantage plans.
Let's discuss, value-based care. How does that differ from traditional fee-for-service care, and why is it beneficial for older adults?
Well, traditional fee-for-service care is a matter of paying per visit. And generally speaking, for anybody that's been going to the doctor, those visits can be relatively short. Whereas value-based care is paying for quality over quantity. And that involves spending more time with the patient, getting to know the patient, developing that trust and relationship that really is going to provide more longitudinal care, more education, more spending time understanding what preventive maintenance and screenings are important. And when the chips are down and you're not feeling well, having a primary care provider engaged in value-based care is someone that you can go to and not have to necessarily go to the emergency room or the hospital. So again, it's quality over quantity.
Yes, we are out of time, but some great insight from you, Dr. Robert Zorowitz. Again, thank you so much for joining us. We appreciate your expertise.
Thank you very much. Great to be here.